Around 8:50, this Euro-Atlantic Airways flight landed safely on the runway at the Grantley Adams International Airport. Shortly after, braving some rainy conditions, 122 Ghanaian nurses disembarked the aircraft and were greeted by local officials headed by Executive Chairman of the Queen Elizabeth Hospital, Juliet Bino Sutherland. Despite the dreary weather, the contingent from the African Republic received a warm welcome. Ms. Bino Sutherland said the nurses come with a range of specialties like critical care, accident and emergency, and ophthalmology, all areas where there are gaps in services here in Barbados.
We are expecting 56 nurses from Ghana to join the Queen Elizabeth Hospital and 66 to join the agencies of the Ministry of Health. That is the geriatric hospital, psychiatric hospital, and polyclinic system. These are nurses of all areas of specialization who were recruited specially to join us here in Barbados. All of them have specialist qualifications. They join us at a time where our need for nursing continues to be great.
The hospital's executive chairman said it is part of the country's continuing efforts to address the nursing shortage.
We're doing our best nationally to ensure that we can increase the output of numbers of nurses at the Barbados Community College. And in all of our institutions, we've enhanced our retention programs for the nurses here in Barbados. However, like many hospitals globally, we are faced with nursing shortages. And there are some countries like Ghana who are producing nurses, excellent nurses, and producing them for the global market.
Meanwhile, Ghana's Director of Human Resources in the Ministry of Health, Dr. Kwesi Asubir, said his country is training nurses at a phenomenal rate.
We are able to produce over 20,000 nurses annually. Looking at the numbers, we think that we cannot consume these numbers locally. We need to support other nations internationally. And this is the first government that has decided, as a matter of policy, to send nurses abroad. And the first country to receive this policy realization is Barbados.
The head of the Health Training Institutions Unit in Ghana gave the assurance that the nurses are well trained.
We have had to follow global standards of training in terms of ICN protocols, that is International Council of Nurses protocols, International Confederation of Midwives protocols. So these nurses meet international standards.
The nurses will be in Barbados for a period of 2 years.